Hello, welcome to this presentation on the SCBScN program. The University of Regina and Saskatchewan Polytechnic collaborate to offer this program. I will be explaining how our program prepares you to become a registered nurse and a little bit about what you can expect to experience in clinical. Our program prepares students to perform the skills and master the competencies required of a beginning graduate nurse. Students become registered nurses after writing a licensing exam called the NCLEX on completion of the program. During the program, you'll learn how to perform many skills. I'm going to talk about a few here. One of the things that nurses do spend a lot of time doing if they work in hospital or long-term care is administering medications to patients. And you will learn how to do that safely, how to monitor for side effects or reactions, and as well how to assess whether the medication is doing what it's intended to do or the therapeutic effect. Another thing that you'll learn how to do in the program is how to monitor vital signs. That includes blood pressure, heart rate, respiratory rate, temperature, oxygen saturation, and pain. You'll learn how to perform physical assessments and how to maintain detailed and accurate documentation of your findings. Nurses provide hygienic care for patients when they're unable to do that themselves, and that's something that you'll learn in your first year. We also develop plans of care for patients in collaboration with other members of the healthcare team. Nurses work with doctors, physiotherapists, social workers to develop a plan of care for a good patient outcome. And another big part of the nurse's role is education. We educate people and sometimes groups of people on their diagnosis, on treatments that they are prescribed, their conditions, many points of education to help patients better manage their health. Registered nurses work in many diverse areas. The most common area for nurses to work in is hospitals. And if you graduate from a nursing program, that's most likely where you'll have your first job. But not necessarily. You can also find nurses in long-term care settings or nursing homes. Nurses are found in prisons. They're found in many community settings, including home care, public health. Nurses often work in workplace settings as occupational health nurses. You'll find nurses in universities or polytechnic institutions teaching students to become nurses. You'll also find nurses in physicians' offices, and more there are outpatient care centers where nurses work ensuring that patients receive quality care in a surgical setting that's outside the hospital, or in an ambulatory care setting where they're doing things like teaching and removing sutures and doing wound care. So those are just a few places that you might find employment after graduating from a nursing program. I'm now going to talk about what you can expect in the SCBScN program. We offer a wide range of learning experiences. You will have labs, seminars, virtual simulation, classroom, online learning, and clinical experiences to prepare you to be a registered nurse. This is our high fidelity simulation lab. We also have other labs where you have equipment that you can practice with. In high fidelity simulation, we have mannequin-based simulations that provide a realistic patient environment. The mannequin breathes, has heart sounds, and you're able to feel pulses. So this provides a more realistic setting to enact a patient scenario. In the labs, our students are able to apply their learning in a safe environment. Our labs help students to build on knowledge learned in the classroom setting. Students will learn how to take vital signs, perform physical assessments, insert intravenous catheters, and many other skills that will then be applied in the clinical setting. You will have 2 clinical experiences in your first year. Senior 100 is a community service learning experience of 40 hours. This takes place in a non-clinical setting. Senior 101 takes place in a long-term care facility. In this setting, you'll develop nursing skills in caring for stable patients, including bathing, feeding, assisting with mouth care, assisting with mobility, and developing a plan of care for your assigned resident. Shifts usually start between 6:30 and 7 o'clock in the morning, but clinical can include evening shifts as well. You also may be in clinical on the weekend. Generally, clinical is 7 to 8 hours, and you also may be placed in an out-of-town setting. We use agencies around Regina, such as Lumsden and Moose Jaw, throughout the program. There are 2 clinical experiences in second year. CNUR 205 and 206 are 12-week courses where you'll apply theory learned in other courses in the clinical area. You will be on a medical or surgical unit in Regina or Moose Jaw. The patients will be acutely ill. You will research your patient's care needs and condition the night before, so you will want to set aside time for research the night before. These aren't days where you'll want to be working in the evening. The shifts vary between 11 and 12 hours duration. And again, the usual start time is 6:30 or 7 o'clock in the morning. Our third year clinical courses are a little bit different. These courses take place in 6-week blocks, and there's 4 specialty courses in third year. CNUR 302 is our child and adolescent course, where you'll be working with a pediatric population, either in the pediatric unit at the general hospital or with a pediatric population in the community. CNUR 303 is our family and newborn course, where you'll be placed possibly in the mother-baby unit or on labor and birth at the general hospital. CNUR 304 is our mental health course, and you may be in acute psychiatry at the general hospital, or again, you could be in a community mental health setting working with patients who are living in the community with mental health challenges. Finally, CNUR 305 is advanced acute care, and in this course, you'll be in more specialty units in the acute care setting, places like neurosciences, cardiosciences, oncology, general surgery. These are places that we utilize for advanced acute care. So all of these courses prepare you to be a generalist nurse. So you'll have a broad range of knowledge in all populations. In fourth year, you will take CNUR 401, which is Population Health and Community Partnerships. In this setting, it's a 12-week course, and you'll take theory along with clinical. Basically, you'll be working in community settings. You could be in AIDS, South Saskatchewan. You could be in a community mental health setting. You could be in a school, and you'll be applying what you've learned about population health, illness prevention, and health promotion in these settings. Nurses have worked at vaccination clinics in this clinical environment. They've given health presentations at schools. It's quite varied and diverse. CNUR 403 and CNUR 404 are our final courses, and these courses take place in 6-week blocks. Students are asked where they would like to be, and there's an opportunity to request a setting that you're quite interested in. And we also request that students do one of these blocks out of town. If you have family or friends out of town, it's a great opportunity to apply to work in a rural setting. We do want to place you in a rural setting to get that experience. But these courses are designed to help you transition to practice as an independent graduate nurse, and you'll be given the opportunity to consolidate all that theory you've learned and prepare for your independence in a focused practice area. So students are often with community health nurses, public health nurses, they're on acute care wards, they're in palliative care, home care, many settings. So this is where you'll get a chance to work with a preceptor, and a faculty will oversee your learning, and after you're done CNUR 403 and 404, you're a graduate. Thank you for watching this presentation. If you have questions, please email nursing@uregina.ca or look at our website, www.sasknursingdegree.ca.